All right, and talking about COVID cases, another concern for the national capital, like we've been talking about, is actually air pollution. It's a double whammy that people of the capital are facing at the moment. We've been bringing you visuals of how it's looking like on the streets. At the moment, today's air quality is very poor. It was in the severe category at several places across the capital just yesterday. And today on the Shera Day, it is not looking very good. In fact, experts at this point trying to actually establish a link between the spike in Delhi cases and air pollution. Let's take it forward with our guest this morning. We've got Raunak Sutaria. He's the founder for Respiro Living Sciences Private Limited. Raunak, as we look at these pictures and we look at what's happening around in Delhi, it's a tricky situation at the moment where the overall national average for spike in cases, COVID-19 cases, are actually going down. Delhi, the spike is up. Now, doctors have said there is some sort of relation with air pollution, but they've not been able to sort of nail down on what exactly contributes to it. But people like you, and in fact on NDTV, every season, we talk about air pollution. What is it and why is it that we have not been able to cure it just yet?
Yeah, hi. Yes, thanks, Sonal. Good morning. I think there are two things. One, this lockdown which we had, the past from March till almost till June, when the lockdown was pretty severe. One of the findings across the country was that the pollution fell by about 40%. So you can, when the comparisons were done for the same period in the previous year, so it quite clearly told that, the activities, the human-generated activities which typically happen around us, which didn't happen during the lockdown. So the lockdown was a very clear case which showed us that, how much of the effect are our actions causing on the air pollution and the climate as a whole. The finding was pretty clear. Coming to COVID times, I will mention that there are published studies which have said that aerosol particles, particles which are less than 5 microns, have been found to be a source of transmission for COVID, especially in very closed areas where there is no ventilation. So what happens is homes, residents who are staying in homes where there is not much of airflow movement, ventilation is low, and the PM levels start going higher, that is where the double whammy is actually going to happen. Because in the winter months, when the PMs are going to be above 100 micrograms, the aerosols are going to be much more in the air. Ventilation is going to be poor in homes where there is no air conditioning. And that's going to be one of the key sources. And when you look at it from the lens of how much of this pollution is caused by human activities, it was very clearly shown to us in the lockdown period that a good 40 to 50% is typically attributed to human-induced activities. So responsibility squarely lies with actions committed by us. Having said that, the regulatory mechanism in the country has not yet caught up with trying to control at least the industrial scale pollution. The individual scale is different, but the industrial scale pollution, is significantly, while there is regulatory mechanisms in place, there is not enough transparency in the system to catch the repeat offenders.
But there are systems in place already, right, Raunak? There is an EPCA, which has Supreme Court monitored. And Dr. Bhurilal is supposed to be heading that. There is supposed to be a graded response plan as well. So much was talked about the graded response plan just last year when it came into force. But somehow we are not seeing the implementation on ground. I think that's where the issue is.
Yeah, because, Sonal, what happens is the EPCA and the graded response action plans needs to start working in summer months, because it's a known phenomena that pollution is going to spike. But the level of diligence needed in analyzing just for example, the industrial pollution data and coming out with directives and timely directives, coming out with directives once the pollution is set in, it's too late already. So timely directives from either the regulatory bodies or the Supreme Court appointed bodies has not been visible enough for the scale of problem that we are facing. It's knee-jerk reactions that's been happening.
All right. We also have Dr. Sudhakar with us. He's the Executive Director of CPR Environment Education Center in Chennai. Dr. Sudhakar, good morning. Happy Dussehra to you. Sad that we're talking about this. In fact, this is the biggest evil in our present times, if I can just put it that way. Are you also seeing a direct relation between air pollution and the spike in cases in Delhi?
Actually, Delhi, the spike in cases is mainly because of people maybe contributed to air pollution also, but people are not following the norms which are regulated by, given by the government. Say, for example, keeping the social distancing and moving across, and that is a main reason, is one of the reasons also. And the spiking, of course, now the winter season has started, and as person said, and it is actually the droplets which is being more spreading through the air, and it also can be an agent of creating COVID cases and spiking in COVID cases. When compared to Delhi, Chennai is slightly better now because I am in Chennai and the Chennai cases are slightly coming down. That is what I can see. And as you said, the government regulatory mechanism is there, but still as an individual, it is mainly because the agricultural residues in Haryana and Punjab which is being burnt. That is the one cause which is giving more pollution to Delhi, which travels. The wind speed, as you know, that wind speed travels towards the northeast, and that is the thing which is giving more pollution. And because of the weather and it is like a smog-like thing.
Yeah, but it just doesn't change, no, Doc, because every year we know about stubble burning, every year there are measures, but we're just not being able to control it. But we'll come back to the story and we'll continue to keep a focus on it. Thank you both for joining us on that. We have Dr. Rajesh Malhotra now join us. He's the chief at the COVID Facility Trauma Center at AIIMS. Dr. Malhotra, thank you so much for speaking with NDTV, taking out the time, and happy Dussehra to you. The biggest demon we're all dealing with this Dussehra is actually the double whammy that Delhi is facing at the moment, with cases spiking up, air pollution also to a near low. Have you, as some doctors are saying, also seeing a link between the two, doctor?
Yeah, Sonal, good morning. It is absolutely correct. Now, what has happened is this winter, as you said, setting in, the pollution and the still persistent COVID, the situation is very complex because more and more people are getting cough and breathing problems. Above that, and that's because of pollution. And over and above that, we have had a surge of dengue infections compared to previous months. It is now appearing. So if the people who are not seeking early treatment for the fear of COVID or are not getting their fear investigated, some of them are coming out to be suffering from dengue and landing with low platelets. So I think the situation right now, because of the different causes of fever and because of the different causes for cough and upper respiratory symptoms, the situation has become very complex.
And doctor, are you seeing that reflected in your COVID facility as well? Or what is the current status on beds at AIIMS?
So we are continuously, have been above 200 cases, which has been the same number as it was at the peak. So what I want to tell is that though the absolute numbers were going down in Delhi for some time and have seen a recent rise, we have not had a respite of the severe cases, of the cases needing oxygen in the trauma center COVID facility. It may also be because of the fact that we are attracting a lot of patients from the neighboring states. But the fact is that the healthcare facilities which are catering to very severe infections have not seen a respite. So still would like to request people to be very watchful and careful because the other problem which I have seen is a lot of people who have recovered from the COVID are going around without masks. And they have to understand that they are sending a very wrong message in the community because the other person may not know that they think that they are immune now and they can go around without masks. And that's something which is bad for others as well.
Doctor, I also wanted to understand, there's a lot of debate going around about how many of these cases are actually from the capital and how many of them are actually traveling from states like Uttar Pradesh where the medical facilities are really poor. Could you give us an estimate of how it's looking like at AIIMS?
It's very difficult to say offhand, but I would say that, roughly about at least, 5 to 7% cases who are severely sick in the facility are from the neighboring states. And that is not related to distance. It's not just the satellite cities. Some of the patients have traveled from very far also. We have patients even from Bihar. So that is an issue because the patients who are quite sick are also traveling a long distance to come to AIIMS, and we have a lot of patients who are actually quite sick and on a ventilator. So while we look at the numbers which are going down, we should be aware that there are still a high-risk population, and the risk of admission to the hospital needing oxygen or the aggressive management has not really gone down as far as our facility is concerned.
All right, Dr. Malhotra, thank you so much for your perspective. We also have Dr. Rajender Dhamija, beg your pardon, at the moment with us. He's the head of neurology department. Sir, your view on the spike that we are seeing in the national capital, what is it looking like where you are and what kind of patients are you getting at the moment?
Sonal, thank you very much for having me this morning. We all have been seeing this for last few days that the numbers have gone up again and they have been consistently rising in last few days. I personally feel that it has to do with the festival season, the winter coming around, and the festivities along with the weddings, along with the the other issues which are becoming apparent in the population, the people becoming fatigued or people becoming a little careless. So these are the things. And the other thing which is very important in Delhi particularly is that the increase in number of RT-PCR tests. That number has gone up in last few weeks from 9,000 to 12,000 to 15,000 RT-PCR tests a day. So naturally, if you do more PCR tests, you're likely to pick up more cases. And the positivity has also gone up from 5% to 7.4% on Saturday. So these are the contributing factors which have led to this surge, and it was expected. And we have predicted.
But sir, can we only and solely say this, that it is because of the festive season, because that's happening across the country, but the national average is actually coming down. In Delhi, we are seeing a spike. So what's the Delhi-centric problem here is what I'm trying to identify.
So population density in Delhi is very high, and the air pollution in these winter months has been known for many years with the smog and the respiratory problems. So if you have this pollution and underlying respiratory issues, so you're likely to have more severe COVID-19. And this all together, the issues which I told you about Delhi was a number of increase in RT-PCR tests. That is one reason why we keep picking up more number of COVID positive patients. The air pollution is the second one. Of course, the festivities is the third one. And on top of that, the coming wedding seasons, I understand that these 2 months after this, the festivals, the weddings are also going on. So all this will combine together, will have a huge impact on numbers, and we not only the increase in numbers, but also the more severe cases will come up, the more number of ICU beds will be required, and more ventilators maybe that would be required as compared to as of today.
All right, Dr. Dhamija and Dr. Malhotra, thank you both for your perspective on the story. Let's also now go across to Sukirti Trivedi, my colleague, joining us live at this point. Sukirti, so the doctors are establishing a very clear connect between air pollution and the spike in Delhi cases as well. Now, we understand at this point that Arvind Kejriwal had asked for a shutdown of the schools and the classes between 9 to 12 which have been opened. You had reported that it was mostly government schools which had opened, but now they are going to be shut as well to the end of this month at least, and that date is also likely to be sort of re-looked at depending on the air pollution level. But at the moment, is the Delhi government able to explain on what this spike is about? Because if you look at the situation, then Durga Puja has been kept off, right? There are other celebrations which have been kept at bay. So does it mean at this point a lot of private meetings and private affairs, that's turning out to be a super spreader?
Well, Sonal, firstly regarding the schools, it was the government schools in Noida that had opened. Schools in Delhi had never opened, neither government nor private schools. The government had said that all kind of schools would remain shut till 31st October, and as per their latest announcements, all of those schools will continue to remain shut. So government schools had opened up, but in UP and Punjab, not in Delhi. Regarding the other festivities question that you mentioned, yes, as far as we look at the government measures, the government is constantly saying that we've not relaxed any of our measures. We've not allowed any kind of big gatherings. As far as festivities are concerned, even all the big leaders are very apprehensive about, for example, the Shahra programs. If you take those, the Prime Minister and the President used to go to the Red Fort Ram Leela, but that wasn't given permission by the Archaeological Survey of India to be even held in the first place. So those permissions were never given. So that is not happening. If you look at the Delhi Chief Minister, even he was requested to participate in several big Ram Leela programs, the Shahra programs or effigy burning programs, but he refused those. He is not going to attend any of those. So as far as the authorities are concerned, whether it's the ground rules for celebrations, they have not relaxed those. At a personal level, they are not participating in any of these programs, trying to send out a message that nobody should be celebrating in a manner that leads to crowd gathering or in fact adding to more pollution by burning these effigies which are full of firecrackers. So that's the message being sent out by the authorities. But yes, at the individual level, what people do is becoming something that's very hard to control. For example, in Kerala, we saw cases spiking after the Onam festivities, and the Kerala government, the Kerala CM Pinarayi Vijayan very clearly said that the government never relaxed the rules. It is individuals who faltered. Many of the people did not follow rules at the individual level. They celebrated, they went and met a lot of relatives, a lot of big family gatherings happened, and that's how cases shot up. So that's something that Delhi also needs to be precautious against.